Faculty collaborators at Oklahoma State University hope to revolutionize the diagnosis and treatment of cardiac and respiratory diseases with a cutting-edge idea: a shirt that monitors a patient's vital signs, then transmits the data to a doctor's office or hospital. ONR's Kathy Tatum takes us to Stillwater to see how the project is making its way from concept to reality.
Machines that monitor a patient's vital signs in a doctor's office or hospital can be big and bulky, not to mention plugged into a wall. Getting to a facility for monitoring can be inconvenient, especially if a patient lives in a rural area. So Dr. Bruce Benjamin decided to create a shirt capable of collecting and transmitting a patient's vital signs from his own home.
What we've done is develop a tool that could go home with a patient, that a patient could wear, be comfortable in, collect all the data, and then that data could be immediately accessible by physicians so they can understand the health status of the patient.
Benjamin is the interim provost of graduate programs at Oklahoma State University's Center for Health Sciences in Tulsa, also associate dean of biomedical sciences. He says developing the shirt requires collaboration between many OSU departments.
It's really a partnership between health science faculty, engineering faculty, and human science faculty.
Professor Satish Bukkaputnam and his graduate students looked at the monitoring idea from an engineering standpoint. They had to determine the best way to collect and send a patient's data.
So if you think about a human heart, it's essentially an electromechanical pump in many respects. From an engineering standpoint, we could treat it as a pump that's excited by some electrical impulses, and as a result, it responds in a mechanical fashion.
The next step, devise tiny sensors to collect the information and continuously transmit it via Bluetooth to a computer. Bukkaputnam originally thought of putting all the sensors, transmitters, and batteries in a big Band-Aid-like patch that would have stuck on the patient, but that might not have been very comfortable. So fashion design experts like Mary Rupert Stroescu from the Human Sciences Department were brought in to make a shirt to house the equipment. Her team had to consider which fabrics and threads would provide the best fit and function. They chose a stretchy polyester lycra fabric because it's comfortable and wicks away moisture. It also let them design around the need to attach heart monitoring electrodes to the body.
So we devised a system that is in two pieces. We have an undergarment that helps the user know exactly where to place the electrode, so it has these openings, and then an overgarment that has these snap caps that would snap onto the electrode and continue up into a piece up here that holds the central processing units inside.
Wires that transmit information from the electrodes are woven into a ribbon sewn into the shirt's top layer.
And they all come up through a hole in the outer garment that are then soldered onto an attachment that goes into the central processing unit. And as we were going along, we realized that these ribbons, even though they have very good signals, when they touch each other, they short the signals out. So then we had to go back through and cover each one of the ribbons with fabric in order for it not to have the proper ground.
The shirt also had to incorporate a fingertip oxygen saturation monitor.
Through my collaborators, I understand now that which finger this goes on is very important. When we were deciding on the shape of the part that covers it, it's okay. If it went over the index finger, it would have one shape. So we were thinking too that if it went on the thumb, that might be a little easier. When you sleep, you might curl up your hand, but no, it needs to go on the index finger. And it just doesn't give us good of a signal if it goes on a different finger. So those tiny little, to me tiny, but very important details are a part of what we're trying to work into the garment so that the end user doesn't have to think a whole lot about doing the right thing.
The prototype shirt still needs a little refining and FDA approval before it will be ready for market in about 18 months. The first users will likely be patients suspected of having sleep apnea. It's a condition where people stop breathing for short intervals while they sleep. Patients are diagnosed by spending a night hooked up to monitors in a sleep lab.
In the coming years, that before you can do a full sleep apnea study, you have to do a home study first. And there's not really a good product available for that market right now. But what's interesting is sleep apnea. The problems that are caused by sleep apnea are kind of a gateway to cardiovascular disease. So if you're a patient that has significant sleep apnea, you're susceptible to congestive heart failure, hypertension, left ventricular hypertrophy, all sorts of cardiovascular problems. So if we can understand what's going on to your body during sleep apnea, that will help us for early prediction of all these other diseases.
Dr. Benjamin says catching those diseases early makes them much more treatable. A sleep study in a hospital costs around $2,000. The vital signs monitoring shirt could cost as little as $300 to $400. Stephen Price is Associate Vice President of Technology Development at OSU. His department helps faculty get inventions like this shirt patented and marketed.
One mechanism for doing that is for Oklahoma State University to help start a small company. And then we license that technology to the small company.
Another way to market the product is to facilitate licensing to an existing company. But regardless of how it happens, the university and faculty with the patent profit from the venture. Then some of the university's profits are available to help launch the next great invention created by its faculty.